I am pleased to provide just a little bit of background. You all know that a few months ago, a coronavirus that normally lived in animals transferred to a human host, probably in what was called a wet market, a wet seafood and animal market in Wuhan, China. There was one transfer, one species jump of a virus from an animal to a human, and that virus, now multiplied, is moving around the world. It has come to the United States, and it is now spreading here. It's a respiratory virus. When it enters our bodies, it goes to the back of our throats and then down into our chests, into the bronchial tubes. It causes inflammation. That's part of the body's response. And as part of that, we can develop fever, a cough, feeling badly, sore throat, and if this virus leaves the bronchial tubes and goes out into the substance of the lungs, it can cause pneumonia. If it does that, obviously, it interferes with the lungs' capacity to exhale the bad air and bring in the good air. If it's bad enough, people have to be hospitalized. They may need assistance with a ventilator in order to breathe. And some people, if this pneumonia and the general systemic inflammatory response is bad enough, will die. There are a group of people who are most vulnerable, just as Dr. Caldwell says, to the most severe aspects of this illness. They're not more likely to get the virus, but if they acquire the virus, they're more likely to have a serious outcome. This outcome is more serious with advancing age, just as it is with many illnesses. It's also more serious if people have an underlying chronic medical condition. If you have a predisposing heart condition or lung condition, if you have diabetes, or if you're immunocompromised in any way. So we would like to do one of the great goals of our current public health programs across the country are to minimize the occurrence of these serious illnesses that lead to hospitalization and, of course, death. Another goal is to dampen the curve. You've heard that said many times. Epidemics start, peak, and then come down. If nothing is done, that peak can be very high, and all the patients then in that peak will come to medical care more or less simultaneously, which makes it very difficult for the medical care system that we have in our country, all the way from doctors' offices and clinics to emergency rooms and hospitals, to respond appropriately to all those patients. If we can spread out this epidemic, dampen the curve and spread it out, we in medical care will be able to take care of patients much better and more appropriately. Now, this virus gets back into our throats and then is spread very readily. It's very contagious from person to person. If I exhale and I have the virus, you don't see it, it's microscopic, but in what I exhale is the microscopic virus. If then you are close to me, within 3 to 6 feet, you, of course, will inhale, and you might inhale something of what I've exhaled along with my viruses. They then land in the back of your throat and cause an infection. So you can see that the public health intervention that is designed to dampen this curve is designed to minimize the spread of this virus so that I don't give it to you. And the way to do that, obviously, if the virus is spread readily from person to person, is to create more distance between us. The more distance between me with the virus and all of you out there, the less likely it is for my virus to infect you. hence social distancing. Everything that's currently being recommended nationally and locally is to increase distance between people. Don't go to large crowded events, for example. There are all kinds of ways that this social distancing is being implemented both in our professional and business lives as well as in our personal lives. So that's the whole rationale between the social distancing phenomenon. I have been impressed, along with Dr. Caldwell, not only what's happening here in Nashville, but nationally. I frankly am surprised that the American public has largely, not completely, but largely, really gotten with the program. They have lots of questions about how to actually implement this social distancing, but they would largely like to do the right thing, not only to protect themselves, but to create a healthier community. You all are doing that right now. You're spreading yourself out. You're asking the public to tune in virtually rather than in person. And that general principle is being spread out, and we're trying to implement for a substantial period of time. I can't give you that exact duration, but for a substantial period of time so that this epidemic curve can be diminished and spread out, thus lessening the major impact on our population and also relatively sparing people serious illness that requires hospitalization. And obviously, we would like to prevent as many deaths as possible. I thank you all for your attention, and I am sure that you will assist all of us, because we're all in this together, in getting with the program and doing the very best to make and keep Nashville the healthiest, disease-free community that we can possibly make it. I'm happy to help you on this and, of course, on any other occasion. Thank you. You're very kind to give me this, your attention.